Greetings. I'm Dázon Dixon Diallo. I'm founder and president of SisterLove Incorporated based in Atlanta, Georgia, and founder and president of SisterLove International, South Africa, based in Johannesburg. Welcome to Black and Vaxxed. I am so excited about this conversation today. Black and Vaxxed is brought to you by a special collaboration of partners right here in Atlanta, intending to bring the best coverage of healthcare, particularly with regard to the prevention of COVID-19, and also educating our communities about what coronavirus is, also known as SARS-CoV-2, in case you've just heard about that. But most people know it as COVID-19. And we'll let the professionals get us more into the definitions and all the medical conversation about that. But I'm really happy to have this conversation this evening with three really, really important people in our Metro Atlanta community who are doing all the things to make sure that our community stays healthy and well. And with regard to COVID-19, we're all working in partnership to make sure that happens. First, I want to introduce you to Nicole Cloud. And right behind Lisa, I'd like to introduce you to Dr. Darren Naugles and our dear friend and partner, Pastor Eric Thomas with St. Peter Missionary Baptist Church. Welcome, everybody.
Thank you.
Thank you.
So here's the thing, y'all. We look like we're in boxes, but we're really sitting at my Nana's kitchen table. And what would typically happen, and this is really the truth, what would really happen is if I'm sitting and I have a friend or two, we're in her kitchen and she comes in, she looks at me, then she looks at y'all, and then she comes back to me and she said, well, hey, baby, well, who are they? And who they peoples is? And she doesn't just want to know your name. She wants to know who you are, where are you from, who you're from, what's your story? And if I didn't know that story, there had to be a reason that I had these people in her house. And so if I didn't know the story, they would have to tell her their story. So we're going to tell our collective kitchen table your story. And in your, just a little bit, but I also want to know in your own pathway, your own journey that you described to us, what was a defining moment? Like what was a pivotal moment that you know has brought you to this moment, like who you are and what you're doing now? Can we do that in just a couple of minutes or less each?
Sure.
Excellent. Well, with recognizing due protocol, I'm going to start with our senior pastor person.
Okay.
I'm going to start with Pastor Eric Thomas. Please tell my Nana and the entire SisterLove universe,
Okay.
the Black and Vaxxed crew,
Okay.
you are.
Okay. It was my pleasure. And I'm very pleased. And I want to thank you for the invitation to be on with you today. I am glad to be here. And we've known each other for a long time. And I know of your great work. So I want to commend you on the great work you've done and the great work you're continuing to do. Not just in Atlanta, but just in the world. And it's a pleasure to be on with the other two participants. I'm fully aware of both of you. And again, I'm pleased. I'm gonna tell you the truth. I was on one of these webinars with Dr. Fauci, and I'm much more impressed to be on with you all today. I'm much more happy to be on with you both today. And so I'm grateful. I am Eric Thomas, and I'm a native of Atlanta. I grew up here, and I went to undergrad. Did my undergraduate work at North Carolina A&T State University in Greensboro, and came back to go to seminary here in Atlanta. And I've been pastoring the St. Peter Baptist Church 18 years. So I guess in this context, what we're discussing today, I don't have clinical background in terms of medicine, but what I have been able to do and have had a great time to do is to kind of get more involved in health promotion for what I would consider to be underserved communities. I started years ago, fresh out of college, fresh out of seminary, actually, and I was working with a company called West End Medical Center. That's how I met Dázon. And so health promotion was my thing. I think initially I started doing prostate cancer screenings in barbershops. I would go to barbershops and fast talk everybody in there saying they needed to come and get a prostate screening. And so subsequent to being a pastor, I have seen the necessity of health promotion in our communities, particularly through our churches. And I guess that's what, if I have a specialty, that's what it is. I've been able to not only pastor St. Peter, but for the last 2 years, I have founded and coordinated an organization called the Metropolitan Atlanta Ministerial Alliance. And there are a lot of alliances in Atlanta and a lot of great churches working together. My work is not political. It's not fellowship driven. It's really more, how can we get more resources? And in my case, sometimes resources is money, but sometimes resources has to do with just information to our communities. So I founded this organization in early November of 2019. I had just had a heart transplant. I had a heart transplant on October 31st, 2019. So I'm a 2-year, 7-month survivor of heart transplant. And I'm grateful to the Lord for keeping me to do this work. And so while I was in the hospital recuperating, with probably the first vacation I'd had since being pastor, I was very clear. The Lord showed me, here's what you're supposed to do. So I'm jotting it down. I'm writing it down. I'm in the hospital. I'm calling out my friends. Hey, we got to do this. And so some of my friends indulged me. And so subsequent to that, we started the Metropolitan Atlanta Ministry Alliance. We have about 60 churches. During the early days of the pandemic, we were actively engaged on the south side of town, doing testing at a lot of churches. And through a partnership I had enjoyed with Humana, Walgreens reached out because Walgreens initially wanted to do flu vaccines. And so and let me say this, I was very interested and aggressive in making sure people get flu vaccines. So Dr. Lisa, here's how I needed heart transplant. I got the flu in 2017, and I had viral cardiomyopathy. So I went from being healthy to being sick in no time. The flu affected my heart muscle. That's why I needed a transplant. So I wanted everybody to get a flu shot. So we doing these flu shots, and all of a sudden the COVID vaccine comes out. And so Walgreens asked, hey, can you think you can coordinate some Black churches? And of course we did. And so with 3 churches, my church, St. Peter, Jackson Moore, which is Northwest Atlanta, and St. Philip's, which is in East Atlanta, we partnered together and we did about 17,000 vaccines that first round. So 3 weeks straight, we were doing vaccines and we were coordinating people. And the thing I learned about that was that people weren't so much against vaccinations. They were just, it had to be presented by what we call now trusted voice, somebody they trust. And most people, trust their pastor, at least to a certain extent. And so we were able to kind of encourage people. We did a lot of vaccinations, and subsequent throughout the summer and throughout up until really the end of last year, we were actively engaged. Metropolitan Atlanta Ministry of Life actively engaged in getting people vaccinated. So we did testing, we did vaccination. Now, last year, Kaiser Permanente found us, and we did education. So we tried to shake loose that last little group of people who are hardline.
Yeah.
So that has been my work.
Thank you for your story. I think it's going to tie in really well, simply because what you mentioned about trusted sources, I think is a key to this. When everybody kept talking about medical mistrust, which is a real thing, and I know that Dr. Naugles and Sister Lisa can talk to this as well. But when people kept talking about it, it's one of those things where you start to reinforce the negative, where people might not have even had a negative about it in the first place, right? It was almost like there might have been people who didn't even know that they were supposed to mistrust the system until you told them they were supposed to. And so I think coming back to that trusted source is what matters, because that no matter what they trust in or don't trust in the system, when they trust in the source or the person that's bringing them the message, it can change their minds and their hearts. And so I want to thank you for bringing that up. And speaking of other trusted sources, I'm going to come over. I'm going to ping pong. So I'm going to come over to Sister Lisa. Lisa, Nicole, tell us, who is Lisa Nicole? I know people see your face, they know your name, they recognize you in all of these different places because you're that sister, right? You're that sister with a bunch of different interests and businesses, and that find a way to intersect them and make them all work. That has to be a part of your own upbringing somewhere. Tell us, who is Lisa and who her peoples is and your design.
Well, again, thank you so much. It's an honor and pleasure to be speaking with you today, as well as the other people on the line. My name is Lisa Cloud. A lot of people know me, like you said, from television or, as a fashion designer. But what they sometimes don't know is that my background is healthcare and science. I actually went to Emory undergraduate here in Atlanta, and then I went to Johns Hopkins for my graduate studies. And so I use both sides of my brain, creatively and analytically. But I love helping people. That's really what my passion is, making people feel good about themselves, but also really inspiring and helping people to understand not only is it good to look good and feel good, but when you take care of yourself, your health is your wealth too. And it's probably more important, because you can make all the money in the world, but if you're not around to enjoy it, what's it for? And so I'm very, very passionate about healthcare, and really helping people understand how to recover from some of these illnesses that they suffer from that can be reversed, things like diabetes and hypertension. And so I own with my husband Elite Medical Wellness Center, which is a holistic wellness center. Obviously, my husband is an MD, so he does practice traditional medicine, but I also come from a background of pharmaceuticals, and I know firsthand that sometimes you don't have to be taking pill after pill after pill after pill. The body can heal itself naturally, eating the proper food, eating the proper diet, vitamins, nutrients, and so I like to try to help people get to the root cause of why they might be sick and address that. And then we can use other remedies that the doctor might feel is necessary. But aside from that, I also am owner of a high complexity laboratory. And you asked the question at the very beginning, what was a critical kind of turning point for you? When the global pandemic first hit, I literally remember sitting at the edge of my bed, watching CNN news and thinking to myself, is this real? Are we really in a pandemic? I mean, they're saying years before we get back to any type of normalcy. And I just kept thinking, wow, I was stunned. But then it's like I heard God's voice say, there's going to be a huge need in our community for testing. I don't know if you recall when they first rolled out the first site where they were going to have COVID testing, it was like at Georgia Tech's campus. It was not in our communities, but everything we heard on television was that we were dying. We were having the most severe cases in the hospital because of all the other comorbidities. And so I wanted to figure out a way to get into our communities and make a difference. And so our lab was one of the first labs in the state of Georgia to deploy mobile testing with churches. We worked with St. Philip's. We also worked with churches like New Birth and Berean and Word of Faith, pretty much all of the large churches, because the one thing I knew is that based on people's historical recollection of vaccines, they were not going to be completely trusting of government testing. And so I wanted us to be a resource. I wanted to be able to get the right message out there, because if you recall, there was a lot of conspiracy theories. I heard things as bizarre as we were putting chips in people's noses when we were swabbing them, and all these sorry about that, a lot of these conspiracy theories. And unfortunately, I heard them from people who had reach and influence that were kind of perpetuating these untruths. And so I felt it was very important when you do have a platform that you are responsible with that platform and that you educate people based on facts. And the one thing we knew is that we were the ones that were dying and having the most severe cases in the hospital. So we tested thousands as, a small minority-owned lab. And I'm very proud of the work that we did in the community and continue to still do in the community, and helping people to understand the importance of getting vaccinated with the coronavirus vaccines. So that's a little bit about who I am. I love helping people. I love making a difference. I love being part of the solution and not part of the problem. I'm from Baltimore, and my family's also from the Virgin Islands. So we wear many hats and we'll work 10 jobs.
Exactly.
we just have that work ethic. And so I love what I do. A lot of people say you work so hard, but it doesn't feel like work when you enjoy what you do. And so, I'm very passionate now. And I'll just say this, because I do think it's important for us to not only be a trusted source in the community, but I also think it's important for us to support our own businesses. And I am the only African-American woman-owned high complexity laboratory in the nation. So, and the one thing is that you're not a number in my lab. You are a real person. And, if your physician called and said, hey, I need this statin because this person is going into surgery, we know where your specimen is. You're not just a test tube with us, So And I think that's important, especially in diagnostics.
Absolutely. And I'll tell you, congratulations on breaking yet one more glass ceiling through the glass door. That's amazing. And it just reminds me, those of us sort of in this moment we are with the Supreme Court decision around women's access to reproductive health is for well over 10 years, one of our working mantras has been trust Black women. So when you hear someone like Lisa Cloud tell you that there is a high functioning complex lab that is led and owned and operated by a Black woman, then when we're talking about the COVID vaccine, this isn't just a trusted source, it's one of our trusted sources. And that I think is really critical to how we're going to get our people healthier and better. And speaking of people who work every day on ensuring that people are healthier and better and healed, welcome to Dr. Darren Naugles. Hey.
Hello. Thank you for having me. I'm so honored to be, on this platform with the individuals, my wife, Pastor Thomas, to just kind of share our stories and kind of share who we are. So thank you for having me.
Absolutely. You're gonna tell my Nana, rest her soul, and the whole Black and Vaxxed universe a little bit about Dr. Naugles. Who are you and who are your peoples?
A lot of people know me as Dr. D or Darren or Dr. Naugles. I am a 2-time HBCU graduate. I attended Clark Atlanta University and I did my residency at Howard University Hospital, the best training in the world, the DC. Yes. And just to go back into my childhood, I was a military child, so I got a chance to travel. My father and my mother, and we come from a large family. My parents had 5 kids. I am a twin, so my twin brother is Derek. My father died at a young age. He was 36 years old. He died of a heart attack. He was actually, we were in Germany at that time, and my father was having chest pain, and they diagnosed him with heart disease and said that he had triple bypass. So we had to uproot ourselves from Germany, and my father was shipped to San Antonio at their Air Force base or their military base hospital. And we went to Oklahoma, and my mom flew to San Antonio. But during those 5 days in Oklahoma, we were with my grandmother, and my mom was in San Antonio. And I just remember the phone call that my mom called back at the house. My sister was older, so my sister was crying, and I didn't know why she was crying. And then I got on the phone with my mom, and my mom said my father did not make it in surgery. So he was actually one of the first people, one of the first patients to ever undergo open heart surgery in 1981. Now, if he would have had it now, he would have survived. But back in 1981, at that time, they had to stop the heart. So everything was on the time. So he did not, a young man, 36-year-old, did not make it. He was very fit. He had high blood pressure, but he was a very fit guy, military, and he died of a heart attack. So that right there really sparked my interest into wanting to go into the healthcare profession. And so I ended up going to Boston University School of Medicine. And a lot of times you kind of go through life and you doubt yourself whether you're in the right place. And this is the moment that changed everything for me. It was my first year in medical school. I'm walking down the hall with a couple of my class, African American, in the group, and the office and the security guard came to us and looked at me and said, "Can I see your ID?" And I'm with all my other classmates and they're white. And I was like, "Why are you asking me for my ID?" So I showed him my ID and I just felt very belittled. I'm like, am I in the right place? And I kind of struggled my first year in medical school. I actually really flunked out my first year in medical school. And I remember I wrote a appeal letter to the promotions committee, and I sat in front of the committee. It's like 15 other white doctors, and they're sitting around drilling me, asking me what happened, this, that. And when I left that meeting, I said, I'm never going to sit in front of a group of people where I had to defend myself and defend my potential. And ever since that day, I made straight A's in medical school. I honored every clinical course in 3rd and 4th year, and I got into my top residency program, which was emergency medicine. And it worked out. I got the best training at Howard University Hospital. I went there for 3 years. Then after that, I spent some time on the Indian reservation out in New Mexico. The COVID COVID came and it took us by surprise. I remember I saw the first COVID patient in Georgia. They showed up at our hospital and they came straight from the airport. They flew in from China. They landed in Washington, Seattle, and then they flew to Atlanta. And he was having symptoms. And I remember the day he showed up in our emergency department, I sat there, didn't know what to do, gloved up everything. I was calling the CDC. I was calling the health department. What do we do? And that guy sat in our emergency department for 26 hours because we did not know what to do. And they finally called us back and said, you know what? He's not sick. He can go home. So we've come a long ways from COVID. I've taken care of some of the sickest people. I've taken care of, in the beginning, it was almost like the Wild Wild West. We didn't know what was going on. We were, putting everybody on a ventilator, and we found that was not the right choice. We're here. We're here now, still in the pandemic. And where do we go next?
So I just want to make sure that we capture this moment of how powerful, not just the work that the three of you are doing, but your own individual stories are just full of gems of information, but also gems of inspiration. I think everyone should understand the power of, and I'm starting with this because it's, I think the weightiest of it, is with the power of recognizing how important it is to actually fail, how important it is to actually be in a position where the only place you can go is up, and that you are the one to decide what the up needs to look like and what it needs to be. And that's come through in each of your stories, whether it's from your own experience with the flu and the cardiac, the heart transplant. The heart story is coming through from all of you. My husband, who is originally from West Africa, passed away from a cardiac event in his sleep at the age of 46 with no prior detection, even as a healthy young man, who had quit smoking, who had survived Hodgkin's lymphatic, and had just decided to be a healthier person. And it was his heart at the end of it. And there was extensive heart disease that had just never been detected. So there's a question too of around these disparities with coronavirus or with COVID that are extended from, as Lisa has talked about, the other comorbidities in our lives. But there's also this understanding that as a people, we have some epigenetic experiences, things that our grandparents, their grandparents, people who are in our ancestry, especially through the enslavement of African and Black people in this country, that our health is still determinate from that, not only from what we eat and from how we move or don't move, of all of those different things, and that the health is our wealth. So I want to start there. Vaccination turned into, who knew that after all of these years, at least in our own communities as Black folks, we didn't spend a whole lot of time, there's a few of us, but we didn't spend a whole lot of time questioning whether our children should get immunizations from mumps or from measles or from chickenpox when it finally became available. I remember those days when, basically we had chickenpox parties. I lived in Stillwater, Oklahoma, by the way, when I was the only Black child in the K through third. So I know that experience as well. So let's talk about how Black people have come to a new day of understanding how we talk about, how we engage with vaccination as adults. Because in children, we're taking care and protecting, and we remember when we were kids. But as adults, now we're in decisional spaces. We get information from all kinds of places, some of them not necessarily trustworthy, but because they have a lot of visibility and a lot of connection to us, we believe in them, even when it's not real. I'm going to ask a personal question, and I want you to talk about the importance of vaccination. When COVID vaccine, not only when it was going through the trials, but when the vaccines, the different ones, were finally coming to the approval and being made, what was your decision point to get vaccinated? And see, I'm making an assumption without asking. So are you vaccinated? And what decision point was it for you personally to get vaccinated, or in your own family? And how did you work through that with people in your own life who might have said, what, you're getting vaccinated? No, not me. How did you work through that? I'm going to start with you, Lisa.
So it's a great question because I think naturally everybody says, is it ready? Is there enough data? Has it been studied long enough? Do we know the long-term effects? So I'll be honest, when they first released and approved it, I did not take it initially. My husband took it, and we had to have some real serious conversations about why he felt it was important to get vaccinated. Ultimately, I did decide to get vaccinated after I looked at what the facts said, what the statistics said, what was happening for people who did not have the vaccine is they were the ones being hospitalized with the most severe cases. And if you had any kind of comorbidities, you had a higher risk of having a severe case of COVID than you had of having a consequence from taking the vaccine. So when I weighed, the statistics that were out there, the facts, I then decided, because I personally have a condition where I do get, I have a high risk of getting blood clots, I made the decision to get vaccinated and also made the decision to get my children vaccinated. But I did look at, evidence-based medicine to make my decision. I didn't go off of just fear, because fear can be paralyzing and the unknown can create fear.
I love the fact that you had a trusted source in your house.
Yes.
And you still made your own pathway to that decision. So, and what we call it in public health is you made an informed decision. And in some ways you made an informed shared decision because you had a medical practitioner who could help you through a lot of the details and the science of it all. And I think that people should recognize the grace and forgiveness in themselves that, yes, you have a trusted source, but what my Nana would call your God voice, right?
Yep.
Which is your intuition, that inner voice. When you combine that with the information, then you reach a decision for yourself. And I'm grateful that you've done this, because now you can speak from the standpoint of not just teaching and preaching to others, but living through that decision process. Tell us about your COVID-19 vaccine decision.
When we first started seeing it worldwide before it came to America, I saw that this damage was to the organs and to vital organs, obviously, and so it made me hesitant. I was just out of transplant, so I was wearing a mask anyway, because I was any little thing when you come out of transplant, I was taking the anti-rejection drugs which reduce your immune system. So I was wearing a mask anyway. But when I saw the organ damage and realized that the flu, which was at that time they would say was not nearly as virulent as COVID, I determined then whenever a vaccine came out, I was going to take it. Now, I didn't strong arm anybody else, but I will say those around me, either through care, concern, or whatever reason, immediately got one. So whenever they came available, I was probably 2 weeks behind when they first gave the shot. And I'm deadly serious. I was 2 weeks behind there, but when they first started giving the shot, 2 weeks later, I was getting my shot. And let me pause and say this. So for a person who accepted a whole nother heart from somebody, it's kind of like the whole do you trust science thing kind of goes out the window, because I'm like, okay,
yeah.
I didn't know. I don't know, because in my case, I don't even know who the card came from. It was a gentleman who had 20 years old at the time. He was 20 years old, and he had just signed, that he was an organ donor. So I never got a chance to get the background on him, but it worked. And so I'm like, okay, if I can take that leap of faith, trust God, I'm going to trust God with, this vaccine. And so that's pretty much how I came about. Information is important. So once I got the shot, I could speak from a place of, hey, I did it. But also I kept doing the research and kept, when I say research, I, read what I would consider to be trusted medical sources.
Yeah.
I say it like that because I had a whole lot of people they were giving me TikTok research, so don't start me on that. But I read it. I was able to kind of share, my story, and then say, hey, I know there's a certain amount of fear, but then here's what we need to do. Let's look at it, let's evaluate it, let's assess it. What we do see, in those in the early days, what we saw was people would get COVID, and there was a good chance that person would die. We saw it. We saw people we knew, people we loved. That was happening quite a bit, And so I said, we don't know what the long-term effects of the vaccine, but we do know what COVID is doing. So I became an advocate through that method right there. And so,
Wow.
I was able to talk. I remember one day a lady, when we were doing vaccinations, a lady came up and she said, she told one of my, church members, she said, hey, who was volunteering, she says, I'm scared. I kind of want to get it, but I don't know, I'm having heart problems. So she pointed at me and said, go over and talk to him. He just had a transplant. So, we talked through it, and I didn't hurry or rush it. But after she talked and said, well, you got it. I said, yeah. She said, how you feel? And this is funny, make you laugh. She said, well, turn around. So I turned around. She said, well, you don't have nothing growing off your head. I don't know where that came from, but whatever that meant, there was nothing growing from my head. And so she went in and got it. So, I became an advocate at that point for just,
Absolutely.
Thinking it was a science, it was scientific, and it was, and I also knew they had been studying for, these viruses for years. It was just a mutation. So I knew it wasn't like they just ran in the lab and just popped up with a vaccination.
And that too is about being informed, because a lot of people had no idea that there are two things, that there's a long history to this SARS virus, right? And that the second part that struck me, and I'm public health educated, degreed, and all of that. What struck me was how common coronavirus is, but that this one isn't, right? And so the way I'm a very visual learner, and I have to use a lot of analogies and a lot of allegories and a lot of everyday experiences. And the way I thought about it is, the coronavirus is like mosquitoes, right? There's all kinds of coronaviruses, just like there's all kinds of mosquitoes, but it's only going to take one of them to give you West Nile, right? It's only going to take one of them to give you one of these other mosquito-borne, or malaria, for example, right? So I saw coronavirus like that. Like, there may be a whole bunch of them that give me a cold, but there's only one that might affect my respiratory and my organs in a way that take me out. So I don't want any of them, just like I don't want not one mosquito, right? So that's the way I had to think about it and talk about it with other folks. How about you, as a medical provider, Dr. Naugles, seeing patients in a hospital setting, even in an emergency department, where you don't know what people are coming in with on any given day? How much of the choice to get the vaccine was related to your own health, as much as it was to the health of the people that you had to work around, or the people that you saw? Because hats off to all the healthcare providers and clinicians who put their lives on the line every day, all day, up to now. Tell us about your decision that you made in terms of getting vaccinated yourself.
With the vaccine, I really understood the process of how a vaccine comes to intuition, meaning that there's steps to bring a vaccine into its early stages, into its stages where now the FDA is approving it. There's steps. And I know that within these steps, when they create the COVID virus vaccination, that none of these steps were deleted. They didn't remove any of these steps. So everybody said, well, don't it take years and years to come up with a vaccine? Yeah, in the past it has, but we had so much money that we were throwing at these institutions to create a vaccine within a short period of time. So we condensed that whole process into a short period of time. And I understood that. So when people came to me and said, well, it takes, it was created overnight, it was created in a short period of time, I really explained to them that they did not leave out any steps. The steps that they used to create the flu vaccine, is the same steps. So I knew that. And for another reason is that I'm a healthcare provider. And in the beginning, we were telling people they should get tested. We were also telling people they should get vaccinated. If I'm going to tell somebody to get vaccinated, then I'm going to have to get vaccinated.
I only have a couple of more questions. And while we're doing that, though, I will say what is really valuable about what Dr. Naugles is speaking of in terms of trusting vaccinations and why. I mean, for those who are meeting me for the first time or just listening to who we are, with SisterLove, the organization that I work with, We are an intersectional organization focused on sexual and reproductive health rights and justice of women of African descent, women and girls, and all of our communities by extension. So that also means that we have been focused on HIV in our community for a very, very long time. And it's actually one of the ways that I was actually introduced to Pastor Thomas was through our work in terms of getting people tested for HIV, educated, and getting people who were living with HIV into care and onto treatment. I've been a part of the HIV vaccine enterprise from the mid-90s.
Wow.
And when I got involved, understood and learned more, and I come from a public health, not the biomedical, but the public health side of things, and learning that, we get the polio vaccine without even thinking about it now, as children. It took almost 100 years, right, to get the polio vaccine. That's because science was slower than it was, as Dr. Naugles was referring to. Other vaccines that have come along, it took over 50 years to get penicillin, right? And we know the role that penicillin played because we all understand this whole history of the Tuskegee, or some of us understand the whole history of the Tuskegee incident or the Tuskegee study that was around syphilis and how Black men and Black families were treated without informed consent, without information, without the ability to know and recognize what their rights were as people participating, didn't even know that they might have been participating in a study. All of that is different and all of that has changed. And I've also known Dr. Tony Fauci for a very, very, very long time in the HIV world. I've known for me, she was Ambassador Dr. Debbie Burks, because she was leading the global effort in a really amazing, robust way around HIV and AIDS in the world. So and I knew that there was a Black woman who was in charge of at least one of those vaccine trials, right? So I knew that there were enough people in my own personal and professional life that I personally trusted. I professionally trusted. I know people who are still Dr. Fauci's patients now. That's what a lot of people don't know. He still treats patients. So for me, it was not a big decision. It was the same pathway as Lisa talked about in terms of getting informed, researching a whole lot of things. I had a binder, just like I had a binder when my husband was in chemotherapy, wanting to know as much as I could from a lay perspective of what my healthcare provider or the doctors might know, only trusting what they do along with the information that I knew. And so it wasn't that big a deal. I actually, had to almost fight for it because I wasn't of age. I have a lot of those comorbidities that would render me most vulnerable to COVID-19, but I didn't have those immune factors that would move me to the head of the line. And so there was an issue of equity there. So that's, I want to come back because Dr. Darren has joined us again, and thank you so much. Luckily, we're doing this in edit mode, so it's all good. None of that will show through when this is finally produced for public viewing. So Doc, when you dropped out in audio, you were talking about what it is and what you realized about people trusting the vaccine. And so I sort of took it up to tell my own story that's very similar to Lisa's around having trusted sources, but also wanting to do that I could at least trust my own mind. You know how they say, trust but verify. So that's what I was working with. And I also grew up in a house of biologists. And it only took a couple of conversations. My parents actually called us all together for a call, for a meet, to talk about what we all needed to understand and know, and what they reminded us about how we learned the importance of preventive health in the first place. So I want to come back to you, Doc, and let you finish answering that piece about your own vaccination process.
Yes. So, with the vaccine, as I mentioned, my testimony is that I told people that I got my first vaccine back in January when they first had the first wave of vaccinators. So it was easy for me to convince people because they trusted me. And if I'm going to be out in the community telling people to get vaccinated, then I need to be part of that group of people that were vaccinated. And if you look at it, and what my wife was telling you from in earlier is that because of the people getting vaccines, that the number of hospitalizations have reduced. The number of people in the ICU, the number of people on ventilators have also reduced. One of the things that we know is that babies born to mothers vaccinated during pregnancy are more protected against the infection after birth. So women who are pregnant, they're doing their baby a service by just getting vaccinated. Unvaccinated pregnant women are at high risk of serious complications or death compared to a woman who is vaccinated. And the numbers don't lie. I'm a numbers person. I see it every day in the emergency department. Most of the people that we admit to the emergency department or admit to the hospital, most of the people are unvaccinated patients. So it is important, one, to reduce the burden on hospitals. I can't imagine if they never had a vaccine out there, how much burden the healthcare system. We would probably still be on lockdowns. Our economy probably would have collapsed. And it just is just a testament of what science has done for us in coming up with a vaccine in that short period of time. And I trust it.
Yes. Thank you for that. Let's get into some basics now about it, right? So what people have heard and learned, well, first of all, we now know that we passed that devastating benchmark of having over 1 million people, right, who've experienced this and maybe haven't survived, or who have survived but are living with long COVID, which is a whole nother thing that people should be deeply, deeply, deeply concerned about. You don't only not want to get COVID-19 so that you're not sick or that you won't die from it, but you don't want to get it because you might actually have to live with it for the rest of your life, as far as we know. And from what I know, that's the exact same message that we use when we're talking about preventing HIV, right? So I think that this is a really important moment for us to talk, just make it plain to the Black folk that, are within all of our reach. What we know now about the vaccines, that there still are in this country the main 3 that are available, or through the 3 main manufacturers, and that there's new news on in some respects with regard to all the different variants and how we know that they're working, and why the hell there's so many variants, and what is that, and how do they keep coming so fast, right? And I'm learning that there's some, Omicron has had some babies basically, and that there's some new variants and variants off of those variants, and that we can expect some more surges simply because people, 1, aren't vaccinated to the level we need everybody to be, or 2, people have really taken to this unmasking really fast without a whole lot of, I've been in 3 airports where it freaked me out, right? So there's still a lot of misinformation and disinformation that's leading people to really relieve themselves of the need to be protected too soon, I think. So I'm going to come back to you, Lisa, and tell us what we know from the lab perspective, from what we're seeing, from what we know, from what vaccines are still out there and available, how they're operating against these new variants, and why are we still talking about it at the level of urgency 2 years in?
I'm in agreement with you. I do feel like we did unmask a little prematurely. I think there was a lot of political pressure to try to get things back to some level of normalcy. But what I do think is important to recognize is that we are still in a pandemic. And the numbers look like they've come down, but that's not accurate. The numbers look like they've come down because we are not testing like we were testing before. And so therefore, if you're not testing people, it looks like things are decreasing. But if you look at data like wastewater data, it does still show that there is definitely cases of coronavirus and that their cases are still increasing, especially after events where like massive gatherings have happened. So I think it's important for people to recognize, keep wearing your mask. I traveled this weekend for my niece's graduation. I got to tell you, The airlines no longer require that you wear a mask on the planes. Even at the graduation, I saw a lot of people unmasked. And, I do think it's something we're going to be living with. So we have to have some normalcy. But I still think if you have any kind of comorbidities that could put you at a higher risk of, getting a more severe infection or a more severe case of COVID, I still think you should take the necessary precautions and mask up. I think you should constantly be washing your hands. I'm going to let Dr. Naugles speak to what they see in the ER, because I always go back to him and say, well, what's happening in the ER? How are the cases,
Right.
what's the factual evidence?
And before I come back to Dr. Naugles, Pastor Thomas, I'm saying this because to Black folk, there's as much of ceremony and ritual to, especially in our faith settings when we're born, as they are when we die. Some of the most trusted and long-standing folks in our communities are our faith leaders and our funeral home directors. So tell me, what's the trend? What's it looking like in yours and in the membership of the alliance that you have with all of these faith institutions? What's the experience now with your congregations? Tell me what it's looking like and why this issue of vaccinations for all of our different congregations, it may or may not still be a really high concern for most of our faith people.
Just in terms of coming to church, and like my church, we open back up New Year's Eve, and I think it has to be a case by case basis. Like my sanctuary holds 800 people. We very rarely have more than 100 people, and everybody that comes in, you either sit with your family, or we have the X mark where you can space yourself out. Just in terms of that, I think we've been extra safe. Mask a necessity. You can't come in without mask. We do temperature checks and all those things. So let's just take March 15th. Let's take March 15th as a jump off day, because I think America closed that next week. We have done the same number of funerals, but other churches have had to do COVID funerals, and it is, I guess, in many ways, it did make people more aware of making COVID real, because some people decided it wasn't real, and then when you started burying people you knew, it got real. Could be a positive outcome is that it created a space where churches can really talk about health matters, and I'm gonna take it a little bit further. If you try to have a health meeting, and so I'm part of the health committee for the National Progressive National Baptist Convention, as well as my fraternity as well, and I remember having a health meeting, and it was just we didn't talk about nothing. But now we're really talking about COVID. But then we're talking about other things in the future. We're talking about this coming Wednesday. I'm talking to somehow or another, I don't know why they invited me, but Walgreens employees, all the African American Walgreens employees in Georgia. I'm doing a virtual conversation with them about addressing diabetes. They brought me in to talk about it from just a faith-based perspective. So anyway, we can have these conversations now because COVID opened the door for us to have these conversations. Quite frankly, the church has done a terrible job over the last 50 years dealing with HIV/AIDS. A terrible job, but we're going to do better now, because now we can have those conversations, because we actually understand that that's part of our work, and the pandemic did open that door for us. So I'm looking forward personally to exploiting it in all my partner congregations, to making sure that when the pandemic, however it manifests itself in the next coming months, we add to our conversations other health issues, blood pressure, diabetes prevention. There's a disease on amyloidosis. I think it's called stiffening of the heart. Partner and a couple of health agencies to start testing. It's prevalent in the Black communities and the communities with Caribbean background. So I'm looking forward to exploiting the opportunity to be more proactive in promoting health, being testing or lifestyle changes. So on all the churches I've worked with, we've been able to understand that in the beginning we had to use masks. We had understood in the beginning we had to test, and then later we vaccinated, and we're still pushing vaccinations. I know I had a young lady who's been in my choir, and just very faithful member, and just refused to get a vaccination. So I said, well, listen, you can't sing, because, and I talk about, it was 6 feet at first when you sing it, it's more like 12, 20 feet because you're projecting. And I said, I'm just not comfortable, and I love you. I said, but I'm not comfortable with that taking place. And I said, all the other people have been very diligent about what they're doing, and we don't want to. And, you know, she brought me some articles and stuff from, you know, what I would call some harebrained media. And I said, I'm sorry. So eventually she called me again and says, well, hey, Pastor Thomas, where can I get a vaccine? And I had to ask her, so what makes you want to get a vaccine? She said, well, you know, I guess I looked at it from, you know, for a while. And she said, I know people who got sick. I know people died. And she said, I don't know what the side effects of the vaccine are, but I do know what the side effects of getting COVID are. And so I'm going to go ahead and do this. And I was proud, not of myself, and I was proud to find it. All I think I did was to tell her, let's look at this thing real. Let's look at this thing from a real perspective. And I think, now I tell the anecdote, not just about Eric Thomas, I tell the anecdote because I think that's what people who are trusted, and like Dr. Naugles said, we got to really kind of get down into it and talk about it. It's still some hanging on. They just hanging on. But I treat it like evangelism. You know, some people come to church and just don't know if they understand this Christ thing yet, Jesus thing yet. Well, you know, my thing is I'm not gonna get impatient with them. I'm gonna talk them through it until.
Right.
And so I'm doing. I call it vaccination evangelism is what we call it.
I love it.
Yeah, go through the details and go through the various things. One lady, she had sickle cell, and so she said, "Well, I don't think I should take it." So I had a friend of mine that had sickle cell, and he was a doctor. He is a doctor. He has sickle cell, and I brought him over to the church just to talk to her. Like, he wasn't proud of people, it was just her. But I think, but that's how we do evangelism. It's one-on-one. And so so my group, my partners, is about 60 community-based churches. When I say community-based, this is what I mean. A community-based church serves 70% of that congregation lives in and around that church, the building itself. And so we're not just the pastor of that church. We pastor the community. We the style coach. We go to graduations. If somebody go to jail, we go down there and sign for the bond. We do all that. And so we do have a little more ability to kind of really put hands on people. And so we're really talking, you know, we've gotten down to, you know, talking to people one-on-one. And I think that's what's going to take with COVID in shaking out, not just, well, the vaccination, but also shaking out, you know, being careful, you know, because, and at least I agree. I was on a plane this morning. I was stunned by the number of people who just dropped the mask, dropped the mask together. And I was at Carnegie Mellon's graduation yesterday. And again, I'm looking around, and I know Carnegie Mellon's a great school. Literally 2% of the 400 graduates had on masks. And I was like, you know, we dropped this thing too fast. But again, my job as pastor is to make sure that everybody knows that they need to wear these masks until whenever. You know, whenever. Yeah. I don't know, probably about 45,000 masks over in my sanctuary. Anytime a church calls to need masks, I got them. And if I run out of those, I know the Lord gonna send somebody with a delivery, because I got to pick up a shipment recently. That's why I got so many. But the church has to be involved with all the nuances in the small amount of things for us to make a difference. And I think we have that capacity. We just got to do it. Yeah. No. And go ahead, Lisa.
I just want to thank Pastor Thomas for being responsible like that. You know, a lot of churches wanted to get people back in the building, but they didn't necessarily take all the necessary precautions. You know, a lot, and I'm just having an honest conversation right now. Yes. A lot of what we see happening, from the CDC mandates to the FDA mandates, there is some level of politics involved. Right. You know? Right. And you can't skim over it, you know? Right. And so they wanted things to get back to normal, you know, so that we could feel like there had been progression. And but you cannot change the fact that the virus is still here. Right. It looks for hosts, because the more hosts that it can find to, you know, I don't know what the proper word is, but it needs a host to continue to live. And so people that are not vaccinated are prime hosts. Yeah. Right. You know? So we have a responsibility, if we really do want to get true herd immunity and truly get things back to normal, to get vaccinated and to be responsible and to continue wearing our masks, no matter whether or not they've lifted those restrictions or not. You know, it can still spread. And I just thank you for continuing to be that example that people will follow, because our pastors are trusted, and we do what our pastors recommend that we do.
Yes. Well, I think what you're saying is too, I was just at a meeting. I was in Salt Lake City, and it was not a big meeting. So it wasn't a crowd, that graduation, but it was a meeting of women in research around HIV in women. There was no question. None of us had a problem with the fact that while we all got those little things that we could put on our badge, it was a green band if you were okay with hugs. It was a yellow band if you didn't want, to get too close. It was a red band if you don't want anybody, less than 6 feet from you, that kind of thing. Giving people options in the different ways they can be safe is important. But what was also important was that in the room, with the exception of when you were talking and they were still sanitizing the mic every time or disinfecting the mic, you were in mask the whole time. And that's because people understood, especially for the people who are living with HIV in the room, that is an important act to take. And by the way, Dr. Darren, please bring the sign.
So I think one of the things that we have to get our politicians to be in agreement is that the state and the local and the federal government have to work together. If you have the federal government mandating mask mandates on trains and planes, and then the local government is declining those or telling that we're not restricting, then that sends a false sense of information to the people. And so we don't know what to do. We have the local government and then we have the state government saying to do opposite things. So who do we follow? So that's what we need. So I think that, we need to get the politics back out of it and put the science back into it. And the science means that as long as you're having surges pop up in certain areas, then that they should start, continue to mandate wearing masks. So, people talk about, are we still in a pandemic? And that's the question. Are we still in a pandemic? And I believe that we are still in a pandemic. We're not in a full-blown explosive pandemic like we were 2 years ago, 1 year ago, where the hospital systems were being overwhelmed, the healthcare resources were being overwhelmed. But we're in a pandemic. In what Fauci terms we're in what we call a transitional pandemic, meaning that there are surges and then there's decelerations. We are kind of in a control phase. We can predict when these surges are going to happen. We predict after graduations. We predict in cities where they have people who are, most of the population is unvaccinated. So we're still in a pandemic, but it's common like in a transitional pandemic. And the reason why is because of these variants. Okay, we had the mother virus, which is the COVID-19 virus. And then now you get these variants, the Delta, the Omicron. And that's because the more the virus is around, the more the virus can mutate. And that's the natural order of life. If something is going wrong, you try to mutate and you try to change it, and that's what we're doing. So we went through the Delta. Virus, and the Deltas seemed to kind of die down. Now we're in the Omicron. The vaccine is effective for most of the viruses, but the studies have shown that it is weaker on the Omicron, and this is why you have since the Omicron wave, you've had an increased deaths in nursing homes. African Americans reached a high in the pandemic phase during the Omicron phase. So more African Americans are being hospitalized, and these are patients who are also vaccinated. And remember, the vaccine is weaker, works less effectively with the Omicron. So we are still in a pandemic. We should still be practicing masking, especially one, if you have healthcare problems, two, if you're a healthcare professional that works in a hospital, works in a nursing home, or you have loved ones who are in a nursing home where you're going to go visit. So
excellent. So the last two things before we close out this fabulous conversation about being Black and vaxxed, not just getting Black and vaxxed, but being Black and vaxxed, right? What is the process now? I mean, it seems to me, there's where I go now, it's in my neighborhood. The tent's been set up in the parking lot at a mall where everybody comes and goes. It's still covered, even if it's not free as it used to be, it's still covered by insurance, and some people are still able to get it for free. But it's still really simple. It doesn't even take an entire 30 minutes out of my life. But tell us, Lisa, what is it? I want to get vaccinated. I hear that SisterLove is coming through with Lisa, and with the lab, with Elite Medical Wellness is coming through with us. We're going to be at Pastor Thomas's church on such and such a day. what happens? How do I get this? And what do I experience when I get a vaccine?
So we've really tried to simplify this process so people don't associate pain with it, because anytime you associate pain with something, you avoid it. So we say it's as easy as 1, 2, 3. You fill out your form so that we have the basic information about you so that we can do reporting, as to the health departments as to who's been vaccinated and stats like that. Then we take you to, and that is filled out electronically on your phone. It takes you.
Do I have to be tested?
No, you do not. You have a choice of whether or not you want to get tested. It's an option. Certainly, if you feel like you could have potentially been exposed, and you want to just know if you have it, we can offer you a test, but it's not a requirement to get tested. Okay. So you fill out the form. If you want to get tested, you fill out both of those check marks. Yes, I want the vaccine. Yes, I want the test. If you have insurance, like you said, the insurance carriers are still covering it. They have done away with the HRSA funding for free tests. However, there are some large entities that got large grants, so they still offer free testing, like at Walgreens and places like that. So you can still get free testing at those places. You come in, you go to the next station, they give you your vaccine. We have 3 types of vaccines, as you know. We have Pfizer, we have Moderna, and we have Johnson & Johnson. I just want to speak a little bit to that as to which one is better. I'm not going to say that any one is better. I will say that Pfizer and Moderna are the most requested vaccines. Johnson & Johnson is still there. I know there has recently been an incident where we saw some data say that they were putting some restrictions on Johnson & Johnson. I would tell you that if you don't have a condition where you have blood clotting and things of that nature, Johnson & Johnson is okay if you are not going to go back and get your second dose. It's a 1-dose vaccine. So if you want to be one and done, Johnson & Johnson is the way to go. As a vaccination site, you have to specifically request it, though. Our instructions and directives from CDC and the FDA is that we give Pfizer or Moderna first unless a patient specifically requests Johnson & Johnson. Right. And the reason why some people do request it is because it is a single dose vaccine. And I'll let Dr. Naugles speak to, what his beliefs are around the Johnson & Johnson vaccine. I think that millions of people have taken that vaccine and not had any kind of complications. So you choose which vaccine you want, you get your vaccine, and you're going to wait 15 minutes in our waiting area, and then you're off and back about your normal routine. Will you possibly have some side effects? Maybe some flu-like symptoms, but they're mild in nature. It's not going to kill you. If you've ever gotten flu vaccine, it's the same kind of similar kind of, symptoms that you get post-vaccines. But it's a fairly simple process. And it's important that you consider getting a vaccination because, again, we don't know how the virus mutates, and every time there's a new mutation, we have to figure out whether or not the existing vaccines cover it, what the side effect profile is, how severe it is. We just don't know until it actually mutates and we can actually look at the data. So, and
there is the possibility that there may come the day when there is a mutation for which the vaccine doesn't work. So practicing all of the same prevention methods that we have, the consistent washing of the hands, the sanitizing. And I was at the New Orleans Jazz Fest. Yes, it was awesome. But there was 150 to 200,000 people out there. My sister and I, we got all the evil eyes because we're sitting there chilling with our masks, right? Because it was important to us. She works in a school. I work with people with HIV. I care about what I don't know. And I'd rather be safe than sorry, literally.
So let me just go through, so everything what Lisa mentioned about the vaccine, she's correct. Let me go through the process of when do you become fully immunized with the vaccine. So let's start with people over the age of 18 and up. over the 18 and up, you can choose from either of the 3 vaccines, either the J&J, Johnson Johnson. You can choose Moderna or you can choose the Pfizer. Let's go with the Pfizer. The Pfizer, once you get your Pfizer first dose, you have to wait 3 to 8 weeks. Remember in the beginning, they said you have to go right at day 21. They said, no, it's either between 3 weeks to 8 weeks that you is recommended that you get your second dose. Okay. After the second dose, you wait about 5 months to get your booster. They said that once you get your booster, you're almost 97% immunized. Okay.
Okay.
So once you get your booster, you're pretty much immunized. So that's the Pfizer. The Moderna, you get 2 shots again, and then you can get a booster. So they said, well, if I get the Moderna, do I have to stick with the same vaccine that I did the first time? No, you can mix. So if you get the Moderna, you get the Pfizer, you get the J&J, you can mix with either Moderna or the Pfizer.
Okay.
So, but in J&J does not have a booster that's authorized. So you have to either get the Moderna or Pfizer. That's why a lot of times we tell people, to get the Pfizer and the Moderna because you can get reboosted with the same. So again, you get your first dose, you wait 3 to 8 weeks to get your second, and then your booster 4 to 5 months. Now there's a second booster you get. A second booster is only recommended to people who are over the age of 50 and who have severe immunocompromised diseases like HIV, like diabetes, like cancer, people on chemotherapy. That's important for them to get to third booster. Okay. And they can wait another 5 months. Okay. That's what people who are 18 and over. Now, the kids who are between boosters are not recommended for any kids who are over from 5 to 11. So kids can get their 2 doses of Pfizer, they can get their 2 doses of Moderna, but it's not FDA approved for people between the ages of 5 and 11 to get a booster. Now, if you're between the ages of 5 and 18, it's only recommended that you get the Pfizer. So that's important. So if you're 17, you cannot get the Moderna, you can't get the J&J, you can only get the Pfizer.
Do they say why that is? And it's just because you're at that really interesting developmental stage?
I think that they haven't approved it yet, and it doesn't mean that they won't ever approve it. But if it's not been approved, then
it's just still the science.
So another thing that they just came out with is it's called Evusheld. It's spelled EBUSHELD. This is a combo drug. It's not a vaccine. It's a protein that they give patients. If patients have had a severe allergic reaction to the vaccine, you're not going to get your second dose. For people who have serious allergic reactions to any vaccine, whether they had a reaction to any of the preservatives that are like, what I mean severe reaction is where they throat close, they stop breathing, those things. You can get what we call the Evusheld, which is 2 injections. You get 1 injection, you get 6 months, because you got all these patients like, I've had this allergic reaction to a vaccine. Right. What is out there for me? The FDA just approved a medication that is 76. It's about 77% in reducing the risk of COVID.
Got it. So I think this is really interesting because we're talking about COVID, because COVID for all of us is so new. But the shingles vaccine works very similarly. For people who are over a certain age, you have to get 2 doses, 1, and then you have to remember to come back 6 months later. When we were children, there are certain multiple doses for certain immunizations. You have to come back. So I think what's really important about what you all are saying is that for as much as we have to take this as it is in the urgency of it as a pandemic because of the sheer virility of the virus itself and because of the numbers of people who have already been affected and the potential to be affected if we don't continue practicing precautions, is that this is not different from how we engage in other preventive health, period. You use protective measures. I mean, people should still be using condoms with sex, even if they are using pre-exposure prophylaxis like a daily pill called PrEP, or getting a shot that you have to get every 2 months to stay protected. So this is normal course for preventive health. And that for Black folks, I think to help with all of the disparities that we're experiencing, we've got to get our heads wrapped around the fact that taking precaution and taking prevention with our health is even more important than how we get ourselves treated when things happen to us, right? So I think that the value most important in what you all are saying today is that this is not new. This is not something that's not already normal in the course of our need to be protective and preventive with our health, from what we put into our guts. I heard you. From what we put into our bodies, into our guts, what we put on our bodies, and how we engage with the health providers that are in our own communities that look just like us, that we know we can trust because our pastor has brought us to them, or because our provider has brought us to our pastor where they're hosting these events, all of that. Speaking of events, we have many that have been going on in this collaboration of Black and Vaxxed. And I would love it, Pastor Thomas, if you want to give out any information of where to follow the Alliance or to follow St. Peter so we know what's happening with your events. Lisa, if you want to also give out details for connecting with the lab or any of the activities that you're doing. And of course, you can see right here on my little square how you can find out more about SisterLove, as well as at our website, sisterlove.org, and our phone number, 404-505-7777 to call if you're seeking or needing an appointment or want to know where we'll be showing up possibly in your neighborhood to do some COVID-19 vaccinating in the next several weeks. So let's start. Pastor Thomas contacting you all, and Lisa and Darren contacting you all. Let's roll it so that the folks can jump on their mobiles and get out.
Okay. All right. For Metropolitan Atlanta Ministerial Alliance, we are at Instagram, Facebook, and Twitter at Metro Atlanta Ministerial Alliance. That's all those will get you to there. And St. Peter's the same. We're on the same we're on Facebook, St. Peter Missionary Baptist Church. That's our page, Facebook page as well. Yeah, and so that's it. So please feel free to join us.
And as you say that, let's just go ahead and finish out with if you had any closing thoughts.
Yeah, I just want to say I want to thank Dr. Darren and at least Nicole for at least Cloud for helping us for doing the work they're doing. And I do want to check back and see how we can partner, how Metropolitan Alliance can partner with the lab and see what we need, what we can do together. I do agree that with black churches, black business need to partner together better. I understand there was an event. Matter of fact, I know there was an event Saturday. I wasn't here, but I look forward to being a part of the future events and making sure we shake out those people who hold them. I'm going to shake them like that, and we're going to get their vaccination. So I'm looking forward to working this summer together. And so I'm grateful to be on here. Thank you again, Dázon, for letting me be on here with you. And I look forward to continue to do this work we're doing. You've been a great partner.
Super exciting. Thank you very much. Lisa.
Yes. So first and foremost, if you are looking for a place to get a vaccine, obviously we're going to be doing a lot of community events in partnership with SisterLove, but you can always come directly to our clinic and you can call and make an appointment. The phone number is 770-637-2928. We do take by appointment only, so just call us and we'll get you in as quickly as we can. That can be for your first appointment, a second dose, or a booster. As far as just some closing remarks, one of the things that is happening right now, organizations like SisterLove is working closely with, the different organizations that have been given resources from the government to continue to help to get our community vaccinated. You will sometimes see that they might have gift cards and things of that nature. Take advantage of that. A lot of times we start to try to talk ourselves out of it, like, oh my gosh, now they're paying us to get vaccinated. There must be some hidden agenda. You got to change the way you think. And the reason why they're putting these types of incentives out there is because our community is at the highest risk for having the more severe cases. And I'm thankful that they're willing to offer incentives to show that hey, we want to make sure that you do have access to the vaccines, which we know can save lives. So don't allow people with these different conspiracy theories to interrupt the way you approach an opportunity like a gift card from a medical organization. It's because we want to get as many people in our community vaccinated, because that will truly allow us to get back to normalcy, because we can get herd immunity. And more importantly, it will help you if you are a person that suffers from any of the comorbidities. It'll make you safer. You know, vaccines can save lives. That is a fact. And one of the things that, you know, my husband and I, we debate sometimes about science. You know, doctors are only science thinking. And, you know, I like to play devil's advocate sometimes and say, well, what about this? And what about this? There's evidence to show that vaccines have caused certain diseases to be eradicated, because enough people got vaccinated. Diseases that were killing people were able to become eradicated because of vaccines. So although there may be some data out there that sometimes suggests maybe on a very small percentage that vaccines might cause, you know, something, it's a small percentage of all the people that have been vaccinated. And so, you know, vaccines can save lives. That's all I like to leave with as a closing remark. We're here to do our part. We're not going to twist your arm. We're not going to force you to do it. It is a personal decision. But what I encourage you to get vaccinated, yes, especially if you have any other comorbidities.
I love that. Vaccination saves lives. That's the alpha and the omega of that message. It's that straightforward. Dr. Darren, any additional contact information or any places where you all are constantly influencing people socially, maybe? And also whatever your final remarks or thoughts might be.
Yes, you know, I'm just going to piggyback with my on what my wife talked about. You know, we are MHAL Diagnostic Laboratory. We are in the communities, educating the community, doing vaccinations, and also doing COVID testing. Elite Medical Wellness here. We are here for a holistic approach to medicine. About 2 years ago, I ventured into a area of medicine called anti-aging and functional integrated medicine. So I've been in emergency medicine again for 20 years. I've taken care of the sick people, but I want to also take care of people in a way to where we teach them healthcare recovery, getting their body back to balance. Ever since the turn of the 20th century, when vaccines were first started and when we were first giving them, they have saved millions and millions of lives. If you look at the polio vaccine, we completely eradicated polio, but we're still giving that vaccine. We're still giving a vaccine to a virus that's been completely eradicated here in the country. Why? Because we fear that virus will come back. And that's the same approach that we should take with COVID. Even if we eradicated COVID, I still believe that we should continue to vaccine people for COVID, because it was just a debilitating disease like polio. You know, more people probably died from COVID than polio. I got to look at those numbers. But in that short period of time, millions of people died from COVID. And we don't ever want to see that happen again. We don't ever want to see our healthcare system almost crumble because of lack of resources.
Right.
So the benefits far outweigh the risks. There are risks with everything, but when the benefits tip the scale, then you got to go with the benefits.
Yeah. And if you in that, thank you very much. You got to go with the benefits. Vaccines save lives. I think that all of you have these incredible stories of your own, personally and professionally, that matter, because what you do for the people who rely on you for information, for inspiration, for affirmation, I think that there couldn't be a better conversation to have about not only why, but the what and the who, and your story, because everyone has one. Your story matters. SisterLove is so grateful for this partnership and for the collaboration. I also think that it's important to remind people that everything still begins with behavior. So no matter how much biomedical opportunities we have with getting a shot, that whether or not you get a vaccine, I'm with everybody here. We're not forcing anything on anybody. We're not promoting any particular label or any particular product. What we are absolutely advocating is for you to take the best decisions for the best of your own health and the health of. That's really what this is about. And being smart about it, but also being conscious about it. And that there's a need to get beyond the fears, as we've heard Lisa talk about. There's a need to get beyond the misinformation and relying on one or two sources versus a multitude of where you can get to comfort. And whether you get the vaccine or not, you still have the opportunity to decide how to protect yourself. So remember and remind yourself every day of the things that we need to be doing. The hand washing, the disinfecting, sanitizing, distancing where you can, especially when there are a lot of people involved. And for the most part, to keep yourself with a peace of mind, because we all need that in this day and age. Black people, whether you recognize it or not, no matter what your station in life is, we're all walking with traumas that require us to be proactive about our healing and require us to be proactive about prevention. I don't care whether it's with a police officer at a simple traffic stop, whether it's when you're in a space where some crazed, racist, homicidal person shows up in a grocery store, or whether it's in a conversation about COVID-19. At the beginning and the end of it all, we are in this together. And as Black folk, we don't have a choice but to do it with each other, for each other, and because of each other. So I just want to thank Pastor Thomas. I want to thank Sister Cloud. I want to thank Dr. Naugles. I want to thank all of you for listening and for tuning in. I also want to give thanks to Sybil Miller and to Bryson Edwards for really supporting and doing all of the background work to bring Black and Vax to life. And I want to give thanks to the Creator and all the ancestors in our universe that continue to guide and protect us every day. I'm Dázon Dixon Diallo, founder and president of SisterLove. And as I would say on my radio show every week, stay with us, stay tuned, stay engaged, and we'll see you somewhere in the field.
Thank you.